Okay, good morning everybody. What's up and welcome back to the channel. Today, as you can see, we're going to be reviewing a very important article called Can Postpartum Depression Be Managed in Pediatric Primary Care? This was published in the Journal of Women's Health in 2016. So we're just going to dive in and look at the key points of the study, see what we can learn from it, and how we can incorporate it into the postpartum journey that we are going through either ourselves or with a client, a friend, a loved one. Keep watching. This article highlights the fact that the most consistent contact that new mothers have with a healthcare professional is during those pediatric check-ins that they have for their child as they progress through those early stages of life. For this reason, the infant healthcare system could be an avenue for improving maternal healthcare outcomes, specifically maternal mental health. This article is a review that evaluates current postpartum depression programs and considers the practicality of incorporating maternal health care into infant health care as a method of managing postpartum depression. Maternal depression is identified within this source as a public health issue because of its wide span of impact on the entire family. Oh, what's the purpose of this article? As I was reading, I considered that the purpose of this article is to really determine whether or not the pediatric primary care setting is the appropriate place to incorporate some of these maternal health care practices. Within the review, the authors identified an approach to individualized support for postpartum depression, which is the screen and manage approach, rather than the screen and refer. As you can probably tell, the former approach, screen and manage, requires an individual healthcare team comprised of professionals and personal contacts that can help achieve these goals related to soothing, treating postpartum depression. It is a method that continuously maintains and pays attention to the mother as she progresses throughout the treatment plan. In contrast, however, the screen and refer approach simply allows the mother to go through a screening process, to prescribe her with any medications and refer her to other professionals so that they can then determine a treatment plan. The issue that we found in this approach is that it leaves too large of a gap between the mother and her diagnosis and the treatment plan available to her, as she has considerations to make that are outside of infant care, but impacts infant care so large in such an important way. Her ability to be mentally present, her ability to care for herself, to recognize the benefit in the things that she's doing, to be patient with herself, to have compassion, to sleep and rest when it's time to sleep and rest. The screen and refer approach, it is a referral to a treatment program that then turns the mother out. A really important thing to understand about the screen and manage approach is that we will have the person who does the screening, the person who does the prescribing of treatment programs, and that would be the healthcare professional. And then it is acknowledged within this review that we can rely upon social contacts, personal contacts within the mother's life to help facilitate these psychosocial interventions. So the results can effectively be delivered and facilitated by non-specialty providers who are trained on their role.